And enthusiastic water crease farmer is admitted with protracted history of the severe abdominal pain, fever, progressive jaundice. Imaging with ultrasound shows mildly distended bile duct with a hyperechoic area within them. What is the most likely cause? So it is very obvious scenario that a water crease farmer admitted in the hospital with, first of all, severe abdominal pain, fever, and progressive jaundice. So this is the feature of the cholangitis. That means it is the inflammation of the common bile duct. And on the ultrasound there is shows the dilated bile duct, and also there is hypoechoic area within this. That means the hypoechoic area within this, that means there is a definitive organism present. So we have to find out which of the organism is responsible. Here the options are Fasciola hepatica, Colonorchis sinensis, Entropia histolytica, viral hepatitis, and leptospirosis. So which organism is responsible for this? And this organism can infect or invade the common bile duct and also the liver. So we know there is very few organism which can infect and invade the liver. So the organism which can invade and infect the liver, it can cause the progressive jaundice, and also there is a right upper abdominal pain and fever. So let's see. First of all, let's see the Fasciola hepatica. Here we can see the hepatica. What do you mean by hepatica? Hepatica means the liver. So hepatica, it means the liver and the common bile duct and other duct. And here we can see it is also known as the common liver flukes. So the liver flukes or helminth which cause infection in the liver is the Fasciola hepatica. It infect human as a part of the plant and food dermatology infection. That means the Fasciola hepatica, it is spread by the plant or by the food, and we know this farmer is a water crease farmer, and it found throughout the world. That means the Fasciola hepatica, it presents all over the world. So Fasciola hepatica, it can infect any area of the world. There are two illness phases. That means the Fasciola hepatica, it causes the clinical symptom by two phases. First of all, acute phase. Let's see the acute phase. The immature worm begin penetrate the gut and causing the symptoms, and these symptoms are, and you can see the fever, nausea, swollen liver, skin rashes, and extreme abdominal pain. So here we can see the fever, nausea, swollen liver, skin rashes, and extreme abdominal pain. They are the feature for the Fasciola hepatica. And Fasciola hepatica, that means it invade the liver. So the most important is the swollen liver on the ultrasound, and there is the extreme abdominal pain. So this point is very, very important, that when there is a swollen liver on ultrasound, there is extreme abdominal pain, that means it is in favor of the Fasciola hepatica. Other options here, such as the fever, nausea, and skin rashes, they are the generalized symptom for any disease. And in chronic phase, what occurs in the chronic phase? In chronic phase, the mature worm in the bile duct. So the mature worm present in the bile duct, and in the ultrasonography there is the hypoechoic area, and it present with intermittent pain, jaundice, and anemia. So pain, jaundice, and anemia, they are the feature in the chronic setting. And what is the diagnosis? Diagnosis by the stool sample or serology, as it primarily invade the gastrointestinal tract, then goes to the liver. So the stool sampling is enough for diagnosis of the Fasciola hepatica, but sometimes serology may be used to see this antibody in the blood. What is the treatment? Treatment is the triclabendazole, and some patient may need ERCP. ERCP, what is ERCP? ERCP is the endoscopic retrograde cholangiopancreatography, and what it does, it a catheter tip goes to the common bile duct, and if there is a foreign body present like worm, it removes the worm. And here the water crease history is important there for Fasciola hepatica. So it is the most important point, that when there is the water crease plant history in this condition, Fasciola hepatica almost confirm. And most classically transported to human through the eating water crease. So water crease farmer, they usually eat water crease, so it is very possible to transmit by this water crease. Ultrasound findings, it present luminal parasite is the classical, and it presents as a hypoechoic area in the common bile duct, and it also contribute jaundice. That means also there is a jaundice present. So now I think it is very clear now that water crease, this water crease is the confirm for the fasciola hepatica. No other option also required, but other option here present supporting, such as the severe abdominal pain, fever, and progressive jaundice. Progressive jaundice, that means it infects or it invades the liver and common bile duct.